Hello and welcome to the fourth CORC online training module. I'm Lee Atkins, I'm a regional officer for CORC, and I'm going to take you through the 6 steps to using mental health measurement questionnaires effectively. Just a quick note about terminology here. I'll be using the term mental health measurement questionnaires, or just simply questionnaires in this context, to mean all of those outcome and feedback measures and tools that are available out there, some of which you can see here on the screen. The main learning objectives for this module are stated here. Objective number 1 is about having a good understanding of how to use questionnaires to get the most out of them, to realise the benefits associated with using them, benefits for children and young people themselves, benefits to practice and practitioners, and the wider benefits to services and teams in which people work. Objective number 2 is being able to apply those 6 steps to your practice to make maximum use of outcome measures. It's important at this point to say that these 6 steps outlined here have been fully informed by the voice of children and young people. We've heard from young people routinely about how they want outcome and feedback tools to be used, and we'll hear from some of them as we go through today's session. So my role is to support practitioners, services and organisations to improve their mental health and wellbeing support for children and young people by routinely collecting and using relevant evidence and data. Outcome and feedback measures or mental health measurement questionnaires have a crucial role in this, and this module focuses on making the best use of questionnaires. And here are the 6 steps that I will run through in this module. By following these steps in your practice or at your service, then the benefits attributed to outcome and feedback measures can be gained by all parties involved. As I said, the benefits to children and young people themselves are really important, the benefits to your practice and the benefits to services as a whole. The first step concerns choosing mental health measurement questionnaires, so outcome and feedback measures that fulfill the aims and purposes of what you're trying to achieve. This in itself is a bit of a process of thinking, and to help you go through that process, CORC have put together the free training module number 2, choosing the right measure for your service or intervention, and I recommend having a look at that at your leisure. At this point, though, it's helpful to understand that sadly, no single measure or questionnaire will fulfill all purposes. Just like in a toolbox, there are a number of different tools, each of their own functions and purposes. There are a range of outcome feedback tools to explore. So the starting point is being very clear on what you want to measure and exploring tools that measure those things, and ultimately to select tools which best fit the purpose in your client group. So think about the age of the people you're working with, think about the length of the questionnaire, think about any costs associated with using the questionnaire. Also, as well, thinking about what you want to do with the data. Is there a need to compare data with other services or partners? So once you've identified a suitable questionnaire or suitable questionnaires, the next step is to really understand and familiarise yourselves with those questionnaires. So I've just described outcomes and feedback tools a bit like tools in a toolbox, each with its own function and purpose. But it may be better to think about them as power tools. So I wouldn't dream of using a power tool without reading the manual first, watching a demonstration maybe, and certainly having a practice. Here, Sam, an ex-service user, describes her experiences of being presented with outcomes and feedback tools for the first time.
I was always asked prior to each session to fill out an online form. This form consisted of questions from the GAD-7 and the PHQ-9. The issue was these questions weren't always easy to answer. One example of this would be the fact that it asks, in the past 2 weeks, how often have you felt a certain way? Most days, some days, or never. What this doesn't take into consideration, though, is how severe those feelings were. It also doesn't take into consideration any other issues that you are experiencing, in the sense that there may be other issues alongside it, which makes you doubt what you should really answer for that question. I found that with this questionnaire, it wasn't always simple to answer the questions, and for some of the questions I just felt like not answering them at all, but due to the fact that I had to answer every question, I would just go with whatever I felt was best.
So Sam now has helpfully highlighted some real challenges that a young person can face when being given a mental health questionnaire for the first time. I think it's important that we consider and explore the challenges that a service user might have when being given a questionnaire. So the first thing to do is download and explore the questionnaire that you intend to use, or the questionnaires that you intend to use. I heartily recommend putting yourself in the mind of the end service user, the person that you're going to ask to complete the questionnaire. So a child, young person or parent, whoever it might be, and have a go at completing the questionnaire as if you were them. Think about how it feels to be asked those questions. How does it feel to answer those questions? Are there any obvious immediate challenges around the phrasing or wording or meaning of the questions? Young people often tell us that actually when we're given a questionnaire for the first time, they feel a bit of mistrust or judged by the questions and not sure what's happening with their data. So these are sort of things, that sort of feelings that might be evoked by being faced with a questionnaire for the first time. Make notes of those feelings and those challenges that you identified when completing the questionnaire in the mind of the service user, and use them to inform your approach to how you're going to use those questionnaires going forward. Of course, we recommend reading any guidance that is available for the measure, so have a look online and have a look on the CORC website. There's lots of information about tools there, lots of advice and tips on how to use measures effectively. The next step is crucial in order to get the most out of using mental health questionnaires. This is about being aware of all those potential feelings and challenges that you highlighted in the previous step, and then using them as a basis for introducing the questionnaire or questionnaires to young people. Young people routinely tell us that questionnaires are important and helpful to them when they are relevant to their situation, when they are explained fully, and when they are actively used in their treatment. Here, Anand confirms this while sharing his thoughts and experiences.
I think what could help though is firstly if the questionnaires were actually specific to the treatment that you've done, or to know if they are, because a lot of the time it doesn't feel like they are. They just feel like generic forms that have been given to you and probably applied to 50 other different treatments. So that would help to feel like it was actually related to what you've done. And secondly, it would also be good to know what's done with the responses you give, if they're used to try and improve the treatment in the future, to shape it differently, because it often feels like a bit of a black hole. Like you complete them, you hand them back in, and then you don't really know what's done with them, if anything. So I think that would be good to feel like you have a bit more influence on the treatment, or at least how the treatment is done for people in the future.
With all of this in mind, it can be incredibly helpful to prepare and to practice using a script to introduce and explain mental health questionnaires to children and young people. The things to consider in your introduction may include why you think it would be helpful to use questionnaires at all, how you intend to use them, and when, and who will be able to see their responses. Keep in mind all of those feelings that the child or young person might have when reading the questions. We don't want them to feel judged by the questions or to mistrust them in any way. Also bear in mind that a child or young person may not fully understand some of the questions or words used, so may need a little help and support to go through them. Allow for the fact that some children and young people may want to go through the questionnaires with you on hand so they can ask questions, whilst others will prefer to complete them alone without any pressure. All of this takes a little time, so do build this into your sessions. Step 4 concerns the way in which questionnaires are used. To gain the benefits associated with measures, they should be actively used with children and young people to explore and to understand their thoughts and feelings. Too often we hear from young people tell us they completed the questionnaire but never saw or heard of it again. Anand is here again to tell us about his experiences with mental health questionnaires.
I've just done so many of them, and also the outcome of them has never felt that relevant, that you kind of just end up doing them on autopilot a bit without thinking about it too much. But I think they could be quite useful actually if you could engage with them a bit more somehow. Maybe the practitioners could go through them in a bit more detail with you and actually think a bit more consciously about what you put down and why certain areas of your life have changed if they have. That would be quite good.
So what does it mean to actively use measurement questionnaires with children and young people? Well, firstly, I think the approach or attitude that a practitioner takes to using them is crucial. Too often we hear about questionnaires being used because they are mandated or as an admin task necessary to fulfil managerial demands. If we want to get the most out of measures, however, to provide better person-centred support for children and young people, to reach positive outcomes quicker, and to provide meaningful evidence about treatment, then they should be used to explore the world of a child or young person, to gain insights into their thoughts and feelings without jumping to assumptions and making judgments. The questionnaires can help us to listen to children and young people to get a real sense of their wants and needs, as well as their strengths and difficulties. Using the results from questionnaires to explore means we're better able to provide empathy and validation for children and young people. We know from research that these things are central to achieving positive outcomes. We should be curious about children and young people's thoughts and feelings, and using questionnaires can help us to be curious, ask those questions that will give us insights. Sam talks about this from her experience of measures in practice.
I feel the questionnaire would be better used if it was used as part of the therapy, as opposed to just a questionnaire sheet given out beforehand. What I mean by that is if the therapist would ask you the questions during the session, and you would actually be able to speak through what it is you're going through, why it is that you feel a certain way, why it is you're answering what you're answering, and to be able to ask the therapist any questions that you have. From my experience, it was just a case of here's the questionnaire, fill it out, and at no point was any of the questions or answers ever discussed. Had I been able to actually speak through with someone about them, I would be able to talk in more detail and justify why it is I'm answering a certain way, and to explain any complexities about any of the answers that I have given. This would both be helpful to myself to be able to speak more about the issues I'm experiencing, but it would also help the therapist to have a better understanding of what it is that I'm going through.
If questionnaires are used in the spirit of exploration, of investigation and collaboration, then information can be captured that might otherwise be missed. If we don't ask the question, then we may never know that piece of information. The information from questionnaires can help us to better understand the impact that the support is having during the care or treatment. If things aren't improving or even getting worse, then it is important to know this and to respond to it. We therefore recommend the questionnaires are used throughout care and are reacted to. Research tells us that positive outcomes are more achievable when clients feel motivated, when they feel involved and listened to. Questionnaires are tools that support us to realise those things. So what does this look like in practice? It means reviewing or checking out the results from questionnaires with children and young people. It means giving time in sessions to get it right, to listen to them, to ask important questions. It can be all too easy to fill in the gaps in our understanding of children and young people by making assumptions, and this risks missing vital information, ultimately treatment failure. Step 5 continues the theme set in the previous step and involves actively using the findings of questionnaires in collaboration with children and young people. Let's start by hearing from Anand about his thoughts and experiences.
It is quite interesting to see how your attitudes and feelings have changed over the course of a treatment. Often because the responses are numeric, it's quite easy to be able to see where things have changed and in what direction, if you feel like things have gotten better or worse, or just if you feel like you've moved in a slightly different direction. That being said, some of the time it can feel a bit like there can just be some random variation though, depending on when you complete the form, what sort of mood you're in that day. And so again, I think some deeper exploration of your responses, being able to look at it in a bit more depth, maybe with the practitioners, could be even better for being able to see how the treatment has helped you and how you've changed over the course of it.
We often hear from young people such as Anand who tell us that they want to be involved with the findings and questionnaires and want to develop their own understanding of their situation. Remember that the results from questionnaires are not hard fact. They need reviewing with the child or young person and should lead to developing the next steps collaboratively. One thing to be aware of here is that for many of the measurement questionnaires there are thresholds or benchmarks available so you can consider the level of a child or young person against similar children and young people. It's very useful to be aware of and to make use of these. Sam reinforces all of these messages and explains very clearly her recommendations for working collaboratively with questionnaires.
At no point during my 5 sessions of CBT was I ever given any feedback on the questionnaire. I feel that feedback is essential because then it can help the patient understand in terms of what things have either stayed the same, improved or deteriorated in terms of their mental health. This can also then open a discussion in terms of if there has been improvement, possible reasons why there has been improvement, and what things that the patient can be doing to continue their improvement of their mental health. Similarly, if there has been deterioration, this can then open a discussion in terms of what reasons are there that there could be a deterioration, and in what ways can the service help the patient to improve their mental health. By doing so, this would then make the questionnaire part of the service provided, as opposed to it just being a tick box exercise on the side. I feel that the questionnaire can be useful if it is used in the correct way. Alongside feedback, I feel that the questionnaire needs to be discussed thoroughly with the patient so that the patient can discuss any issues or any questions that they have regarding what is on the questionnaire, but also so that the therapist can have an open dialogue with the patient to get a better understanding of their mental health issues.
Naturally, the final step takes us right back to the starting point, well before any face-to-face work with questionnaires takes place. And this is to plan and to prepare all of what has been covered in the previous steps. Over to Anand for the final time for more of his thoughts.
I think something that would be good would be just more engagement between the practitioner and the patient around the forms, why they put the responses they did, just exploring in more detail why they felt the way that they did and how things have changed. And I think it would also just be good to know that the practitioner actually has some engagement with the outcome measure themselves. Like sometimes it just feels like it's a form that's been handed to them and then they just hand it to you and that's it. Sometimes you don't even feel like they've actually looked at it themselves. So I think that would be the first step to feeling like outcome measures are more positive for patients.
In terms of planning ahead, this means getting prepared, practicing, and developing your approach to get the best from questionnaires. Too often we hear about challenges or faults relating to questionnaires that actually relate more to how they're being used rather than the questionnaire itself. To return back to the toolbox analogy, we shouldn't discard the hammer as a good tool because we're unsure about how to use it or we use it for the wrong purpose. Hammers aren't very good at screwing screws in, for example. When you're planning your approach to using measures, consider all of these points here and ensure that you can both answer them yourselves and that you can explain the answers to a child or young person. So make sure that you're clear on why you're using measures at all, how you plan to use them, how you will consider the data from them, how you will work collaboratively with service users to understand and interpret findings from questionnaires, and lastly, what happens with resulting data, including who sees it or who doesn't see it. I would like to highlight here something which I highly recommend to you to take a look at. Colleagues at CORC work with some young champions at the Anand and Freud Centre to explore their thoughts and experiences of measures, and the result is a very watchable video setting out good practice principles from their perspective. So to finish this module, I want to highlight some of those important principles for using mental health measurement questionnaires with children and young people, principles that should shape your approach to doing so. As stated previously, to get the benefits from using questionnaires, they should be used with a suitable approach and not as a tick box exercise, such as an admin task or such. One principle that we always seek to highlight here is that these two questionnaires should benefit the child or young person that's being supported. The child or young person should realise the benefits directly through improved care, collaborative, responsive, integrated care. An important principle to bear in mind is to have a plan for why and how you intend to use the questionnaires and the resulting data. Without having this plan, there is a risk of making the whole process meaningless and even detrimental to the intended outcomes. Lastly, I want to stress that I'm not suggesting here that simply using a questionnaire will provide all the information that you need to provide the best support for a child or young person. It is by bringing all the bits of available information together that this can be achieved. So, have we covered our learning objectives? Hopefully you now have an understanding of the 6 steps to getting the most out of using measures and can apply those 6 steps to your practice. Please do go through this module as often as is helpful and get in touch if you would value any help on a particular aspect of it. Many thanks for your time and attention. We look forward to engaging with you in the near future. I want to emphasise here that the team at CORC are here to help and support you and your organisation or service to adopt and implement this approach to using measures. We offer a range of support and guidance, including all kinds of direct work, training, helpful tools and consultancy. So please do get in touch via any of the means listed here and we'll be happy to talk with you. Thank you.